as much.
All right, you're still on to Independent Television. Glad to know you're still with us. We're reaching you live from the heartbeat of Nigeria, Benin City, Edo State. Okay, this is the next segment of the show, and today, being the 5th of May, it's been set aside to remember the caregivers, those who are in the forefront as far as taking care of our newborns and our mothers is concerned. We're talking about midwives. Today is an International Day for the Midwife. It's a global commemoration. And we have in the house with us this beautiful Thursday morning a lecturer at the University of Benin Teaching Hospital, Department of Midwifery, School of Midwifery rather, at the University of Benin Teaching Hospital. And also, she's also an assistant chief nursing officer. Midwife educator, at the University of Benin Teaching Hospital. Ladies and gentlemen, Faith Odia is her name. Good morning.
Good morning.
Okay, it's a pleasant welcome we want to give you this morning. Now let's talk about your day being commemorated today. Yeah. They say it's 100 years of progress.
Yes,
100 years.
Absolutely.
So what progress has been made as far as midwifery is concerned? But before we talk about the progress that has been made, let's talk about who really are these people? People hear midwife, midwifery, and all of that. We don't really know what they do. Even though we have doctors in the hospital, we have other health practitioners in the hospital. Who are they? What do they do?
Well, a midwife is somebody that is licensed by the Nursing and Midwifery Council of Nigeria and has undergone the training by the Nursing and Midwifery Council, and she is liable to practice as a midwife in terms of taking care of a pregnant woman, in terms of during a pregnancy, during labor, and after delivery. Also providing family planning services. The role of the midwife cannot be overemphasized in that the midwife must possess the 6 C's of nursing care. The first one is she must have that caring spirit. To take care of a pregnant woman is a vigorous stress. So she should have that heart of care. She should be empathic in providing care for the pregnant woman. She should be compassionate. You need to have that compassionate spirit to take care of the pregnant woman. Then communication. She should be able to communicate freely with the pregnant woman in terms of taking decisions, in terms of seeking interventions, clinical judgments, both positive and negatively. She should have that courage in terms of being proactive. If there is an emergency, she should be able to make sure that she attends to that emergency immediately and promptly. She should also make sure that she is committed. Commitment in that taking care of a pregnant woman with all her heart, wholeheartedly. She's committed to care. During antenatal, she's able to educate them the kind of food they should eat, the kind of exercise they do, what they should expect during pregnancy. Because pregnancy is a physiological process.
That's true.
A lot of changes occurs during pregnancy. She also tells them the kind of drugs they should take, their hematinics, what they should take. Then they should also keep to hospital appointments. Now we do focus antenatal care. You see that most of these pregnant women, they come to the hospital, they ask real questions. So as a midwife, you are committed to their care because you should take care. That's why the world today, we are celebrating the midwife all over. The 5th of May, we are celebrating the midwife. The WHO has recognized our efforts in providing the care that we are rendering to the mother and the child, because they know that we have really tried in terms of reducing maternal mortality, but we still have much work to do. That's why we are being celebrated today globally, for us to know that they recognize our work as a midwife, because without the midwife, they are the frontliner, they are the backbone of maternal and child health services. Without the midwife, you cannot, because she's the first person that sees the newborn as the newborn, and there is interaction. The meaning of midwife is the woman that is being, the woman that is in between, that is a woman with a woman. That's the meaning of a midwife. You are standing there. There's interaction between you and the pregnant woman.
So apparently a midwife is a mediator.
Yes, yes. You have been with a woman.
So in your opening statement, you actually made mention of trainings.
Yes.
You know, we live in a world now where we have so many, in quote, unqualified healthcare providers. I mean, these people who go to, they call them auxiliary nurses. Yeah. Now, a good number of them actually claim to be midwives. Okay. They even open healthcare centers.
They are not.
They run it. They do.
Yes.
They run it. I can give you 1 or 2 instances. Now, what's happened to these people? Okay. Do they have the license?
They don't
do
have.
Do they have the basic training? They
don't have. That is why the Nursing and Midwifery Council of Nigeria, they are after those auxiliary nurses. Auxiliary nurses, they are not midwives. They are not nurses. They are not qualified. That's why I mentioned that. For you to be a professional and a licensed midwife, you must have undergone training by the Nursing and Midwifery Council, and you'll be licensed to practice. License to practice is that you have your license number, you have your PIN number, then you have done the exam, you have registered with the Nursing and Midwifery Council of Nigeria, not with a quack. Not like what the auxiliaries do, is all these small miniature hospital that train them. Then after training, you see that
retain them.
Yes, they will retain them. And the public, they don't know the difference between a registered midwife and an auxiliary nurse because everybody is wearing white. Everybody is wearing uniform. But I know the Nursing and Midwifery Council, they are after anybody that you see that is not delivering care to standard. Because what we do, we are being taught standard. We have ethics. Do you understand? Yeah. So what we do is that when we see those people that are doing this auxiliary work, we inform the Nursing and Midwifery Council of Nigeria, and they go in there.
Swim into action.
Yes, they swim into action because we don't want maternal mortality rates to increase. It's already increased. We don't want additional increase to maternal and child mortality rates.
Okay, you already talked about the fact that people should actually know how to recognize these persons. But how can a layman out there, all right, who does, I mean, you cannot just go, someone that wants to get to bed is already under pressure. The family members who's around him, around her rather, they're already under pressure and all of that. How do you know?
I don't know who is who.
Yes, how do you know that this person is not qualified to do this? Even though you have been hearing news of, oh, they know how to deliver very well, they have done it before, they did it for a neighbor, they did it for a sister and all of that. And then you get it, the person is not qualified. So how do you know?
That is why it's good for you to go to a recognized hospital, like a teaching hospital. There are some private hospitals that are also making sure that it is only trained and licensed nurses and midwives that work there. So before you go in there, it's like you are building a house. You should know the kind of setting. You should see the standard. You should see the things that they do. And their dressing, their attitude is different from a professional nurse. It shows. The way they do things is different from a professional nurse. We follow ethics. We follow principles. We follow aseptic technique. A lot of things that we do that they don't do. They are just like apprentices. Do you understand? Going to the hospital, watching what somebody is doing, then at the end of the day, they feel that they have specialized in it, but not knowing the theoretical aspects of that, of the job. They just watch. It's like a mechanic watching his master fixing, okay, today go and bring nuts, do it, she's watching. But the physiology behind that, they are not aware of it. It's
actually done in the classroom.
In the classroom, they are not aware of it.
Of long time
of training and learning, even with clinical experiences also, both are being put into place. Then at the end of the day, an exam is written with the Nursing and Midwifery Council of Nigeria. If you are able to pass that exam, you will not be registered. So those people, they don't undergo such training. That's why they are regarded as quack. So we don't encourage quack. Go to a
they see themselves as auxiliary nurses.
They see that, they see themselves as auxiliary nurses.
Do you also call traditional birth attendants as quack as well?
Well, tradition is as old as man because tradition is something that you cannot just put away immediately. So what we do as midwives, we teach these TBAs, aseptics. We supervise them. We make sure that we intervene. And we also tell them not to practice those harmful things that will endanger the life of the mother and the inborn child.
So don't you think these young girls now, sorry to cut you here now, because if you see most of the people who are into auxiliary nursing, they are young girls. So don't you think it's an advanced stage of the old system of childbearing? So instead of kicking them away, is there no way you guys can integrate them into the system?
Absolutely. Now, There is midwifery education. That's why we are telling the government to invest more in midwifery education. Like in my place of work now, School of Midwifery, we admit basic midwifery now for 3 years.
For 3 years.
You see them coming. We have the 4th intake now. We just did the interview for them. Yes, they can come. When they have their 6 credits, they will be admitted.
Instead of sending them away.
No, so that by the time they now have that training and they are licensed to practice, they are good to go. They can practice anywhere.
All right, a quick one. Maternal mortality ratio in several low-middle income countries is alarming as we speak now. Of course, Nigeria is an example of that. About 34% of global maternal death occurred in Nigeria and India alone. Now, according to WHO, the MMR of Nigeria, that's talking about maternal mortality ratio now, is 814 per 100,000 live births. Now, what I'm asking you this morning is, the lifetime risk of a Nigerian woman dying during pregnancy or during childbirth, postpartum or post-abortion is 1 in 22, in contrast to lifetime risk in developed countries, which is 1 in 4,900. This is a very negative record. What's your take?
Yes. Maternal mortality is the death or the loss of a pregnant woman after delivery within 42 days. Now, if you can see that the rate is alarming, it's appalling, 1 in 22 as compared to a developed country. There are a lot of factors that we need to put into consideration. Now, we are a developing country, we are still developing. First and foremost, delay in seeking medical care. These pregnant women, they delay in seeking medical care. Delay in decision making on where will I give birth.
On the part of the pregnant woman?
Yes, on the part of the pregnant woman. Where will I seek antenatal care? Then delay on the part of the healthcare facilities to attend immediately to the needs of the pregnant women.
By using proper triage system.
Yes, when there is inadequate infrastructure, no good road. Right now, we have 34,000 primary healthcare points. Primary healthcare points, but it's hard to reach. Is it accessible? Do we have good roads in those health centers? Is it affordable? Are there a lot of equipment? Is it available when you go to a hospital in the rural area? Because a teaching hospital is supposed to be a place where there is complication. You will now refer the patient. In a primary healthcare center, there's supposed to be facilities that will enable the midwife, the doctors, everybody in the healthcare team, take care of that pregnant woman. Like CTG will be there, ultrasound scan will be there. Not referring a woman from Oluku to UBTH to go and do scan. Those things should be made available. So in the developed country, you see that they have those things available. So if you don't have those things, how will you now take care of a pregnant? If a pregnant woman, a woman in labor, start bleeding now, there is no blood to give to the woman. What will it result to? The woman at the end of the day was okay, go and get blood in so and so. You can imagine the distance. But those things supposed to be made available. That's why we are also beckoning on the government. The government has a huge role to play in the reduction of maternal mortality, because the alarming rate of maternal mortality cannot be overestimated, because women are dying. Imagine 1 in 22 dying as compared to a developed country, because they have put things in place. There's a support system, there's a working system. Things are working. When things are working, this rate of maternal mortality will be reduced, will be curbed. Do you understand? So we are also calling on the government to make sure that these facilities, they are well equipped and skilled professionals. They should improve on making sure that people are there in the facility, employ more people, train more midwives, give them incentives, recruit more people, encourage them, so that at the end of the day, when a pregnant woman is coming to the hospital, she's smiling. She's not coming there and saying, there is no this, go and buy this. That's why you want this drug, you say, go there and buy. You want to do this investigation, go and buy, go and do it outside. With that pregnancy state, with that stressful state,
no patient relative.
No patient relative to assist her. Do you understand? She all alone to accept to go and do scan elsewhere. Maybe coming back, they'll tell her that, okay, this test, you have to go and do it in UBTH. Just imagine that kind of situation.
In your response, you've actually talked about some of the challenges and some of the problems. Because of our luxury of time now, we don't really have time. But however, why did you not choose this profession? I mean, you would have been a gynecologist, you would have been a theater nurse, you would have been a pediatric nurse. So why did you choose midwifery? Midwifery,
nursing is a passion to me. I love nursing. Okay. A midwife is somebody that takes care of a pregnant woman during labor, after delivery. I love putting smiles in the woman's face, because by the time the woman gives birth, the woman forgets the stress that she has undergone. And a midwife is that person that sees the first creature that God has created.
So do we have male as midwives?
Yes, so men go into, yes, they are. They are.
Profession?
Yes, they are.
Wear uniform and deliver women of pregnancy?
Yes, they are.
In this part of the country?
They have, yes.
Okay, let's go and pick from just 3 years.
Yes, 3 years.
Just 3 years. Okay. What do you think?
I guess that's on the light note. Anyway, for time's sake, we can't go beyond this because the news will be served you at exactly 9:30, and then the concluding part of the program will come through. 100 years of progress, that's what the midwives are celebrating today. It's been an amazing time with you.
I want to appreciate my HOD.
Okay.
I want to appreciate ITV for the opportunity, the Esama of Bini, the management of ITV, for celebrating with the midwife globally. 100 years of progress is appreciating.
Of course,
in fact, my HOD, Mrs. Franca Esebame, she has given me the opportunity to be here. If not, I was supposed to be at work, but she said I should come and represent the midwife since we have been celebrated today. Thank you so much. Kudos to all the midwives. Continue to provide the best care efficiently, effectively, and make sure that you give the best treatment to your clients.
All right, absolutely.
Thank you so much. Congratulations out there.
Appreciative note. Thank you so much, Mrs. Odia. All right, the concluding part of the program will come your way after the news. Please stay with us.